South Africa's healthcare workers continue to serve on the front line of the fight against COVID-19, but now there's another battle with personal protective equipment. The National Education, Health and Allied Workers Union has approached the courts to force the government to comply with the Occupational Health and Safety Act. Maseko Ratlacha is following the story for us. She joins us now live from the newsroom. So nurses are, of course, at risk and they've had enough.
Shahan, that's basically what the nurses are saying. They're saying that as the essential service workers who are at the front line, who are expected to look after those who test positive for COVID-19 or those who are suspected cases of COVID-19, are always in contact with them. They say that they do know that, of course, the doctors as well are at risk, but they are saying that they're the ones who spend more hours with these patients. And what they're saying basically, Shahan, is that at the end of the day, as you know, with the Deputy Health Minister promising last week Friday that the government is working closely with the private sector along with the government of China to make sure that they have delivered PPE to our hospitals over the weekend. They're saying that that hasn't happened. The nurse that I spoke to, actually, Shahan, was at work yesterday and says that there was no, adequate PPE. He says it's just the normal masks that don't necessarily protect them from the virus, but basically what he's saying is that at the end of the day, they might be forced to down tools. Here's Rich Siklina.
We just want to help South Africa to curb the spread of this virus. But now we are left with no choice. We are left with no choice because we've been shouting PPE. We've been shouting protection. We've been shouting protection of frontline staff. The only solution that we are left with now is to withdraw our services, to say we are not going to nurse a patient who is a suspect or a confirmed case, because that simply means we'll be throwing ourselves into the deep end of death. And who is going to take care of us at the end of the day? If we are throwing ourselves into the deep end, it means we are dismantling, we are destroying the front line. Once we destroy the front line, it means South Africa is exposed. All the hell will just break loose. Therefore, the only solution, the only way we can stop the spread of COVID virus, particularly among healthcare professionals, nurses in particular, who spend more than 24 hours with these patients, is to say, if there's no PPE, don't go there.
All right, so Maseko, tell us more about this PPE equipment that healthcare workers are asking for.
Well, Shahan, as the World Health Organization had said, previously, before we actually even had our patient zero here in South Africa, was that not all masks are actually, adequate to protect a person from contracting COVID-19. So there's specific masks that nurses need. They are saying that they don't only need, for instance, the gloves that, that people are also wearing these days. They need more than that, Shahan. And actually, it was very strange because this morning, not strange, but very disappointing actually for me this morning when I received a call from another nurse in the province of Limpopo saying that she too is worried. She was concerned because she says she's almost 60 and she stays at home with her husband and 3 children. She cannot put them at risk when she goes back home, and they don't have the adequate PPE. For instance, we also have pictures of other nurses at a hospital here in Gauteng who have opted to even buy themselves raincoats to be able to try and protect themselves from contracting the virus. They are saying that they don't even know if those raincoats would be, adequate equipment, but they are trying anything at the moment. So they, they're going into their own pockets and buying this equipment to be able to go to work. And basically what Rich was telling me is that some of the other things that they need is, for instance, boots that would cover, their shoes, that would cover their pants. Some nurses, actually female nurses, go to work with skirts, so they want every single part of their skin not to, be exposed at all while they are looking after those who are either suspects or who are confirmed COVID-19 patients. But here's, what Rich was saying about exactly what it is they need from government.
We are talking about gloves, we are talking about masks. Masks are different. This one is a surgical mask, the one that I'm using at the moment. It's a surgical mask. It's more permeable compared to the N95 mask. We're talking about those, and also disposable gowns. We're talking about sterile gloves. We're talking about boots. We're talking about something that is going to cover your shoes, so that no part of your skin will be exposed when you are nursing these patients. Then at the moment, we don't have such.
So what's the health department saying?
Well, according to the nurses that we've spoken to, they're saying that their managers are saying that the government is saying that this equipment will arrive on Wednesday. But of course, we heard that it would be arriving over the weekend. So we did call the spokesperson for the National Health Department, and this is what she said to us.
The minister will say something about it. Everybody's asking me, so he's aware that something he needs to communicate.
Okay, will he be
communicating
it today?
We're going into a meeting with him now, ne?
Okay, all right. Thanks,
okay,
Dr. Manzi.
All right, we'll leave it right there, Maseko Ratlacha.